Hello, my name is Sophia Abdallah. This is SPCE 683, um, Professor Bafa. This is my case study 3. So let's look back on the client's information. Our client is 4 years old and we'll call her Somi. Somi has ASD and ADHD. Somi's current behavior of concern are screaming and tantruming. So we're specifically going to work on her screaming behavior, in which the function is access to tangibles and escape from demands. The interventions we chose to that would work best for Somi is using priming and functional communication training. With priming, we're going to be using visuals such as timers when transitioning from a preferred to a non-preferred activity. We'll also use FCT, so functional communication training, in which we will teach Somi to use communication via PEX boards to ask for more time with an item, or when she wants a break from a demand, or when she wants a specific item. So the methodologies of training that we're going to talk about is behavioral skills training, validity, and treatment integrity. Behavioral skills training, BST, is an instructional procedure used in ABA to teach new behaviors or skills, and it's often used in staff training. There are 4 steps in BST, which include instruction, modeling, rehearsal, and feedback. In the first step, instruction, we're going to provide instructions that are very clear and concise on how to conduct the interventions. We're also going to make sure examples are given if needed, and that we're explaining the rationale behind the skills taught. And we're going to do further explanations if needed. Now, with modeling, we're going to model how to correctly conduct the skill, and we're going to address any difficulties that occur. Now we're going to talk about rehearsal. So the learner will practice the skill in front of us, and the learner will role play the skill, and we're going to offer guidance and support and encourage the learner to ask any questions. Now feedback. So after we see how the learner is conducting the skill, we're going to provide any feedback as needed, and we're going to make sure to provide both positive and constructive feedback to the learner. So validity is how well a test or tool measures what it's supposed to measure. If something has good validity, it means that it's more accurate and meaningful. Internal validity is about how confidently we can say that the results of a study are caused by the factors we're testing and not by anything else. Best way to do this is first collect baseline data, and then we're going to monitor Somi's progress in the intervention phase. External validity is about whether the results of a study can apply beyond a specific situation, people, or conditions in which it was conducted. So we're going to use generalization. We're going to plan to create and use generalization to make sure the skills are being taught across different settings, people, and contexts. Lastly, social validity. Social validity is about whether a behavior change or intervention is meaningful and valuable to the people involved. So we're going to test social significance. We want to make sure that the interventions that Somi will learn are meaningful for her and her family. And we're going to do that by collecting feedback of social validity by using questionnaires and surveys after the interventions have been placed. So treatment integrity is making sure the treatments or interventions are done exactly as if it was planned or designed. So we're going to make sure that we're regularly supervising how our therapists are conducting the interventions. We're also going to be giving ongoing feedback to our therapists, and we're going to be taking inter-observable agreement IOA data to make sure that we're getting the same results in our data. And then we're also going to make sure our therapists are self-assessing and seeing how they think that they're conducting everything. Now lastly, we're going to look at the task list. So we worked on I4. We selected supervision goals based on an assessment of the supervisory skills, cultural variables, and the environment. We also worked on I5. We identified and applied empirical, validated, culturally responsive performance management procedures using modeling, practice, feedback, reinforcement, task clarification, manipulation, and response effort. We also used I6. We applied a function-based approach, performance diagnostic, to assess and improve supervisory behavior. And lastly, I7, we made sure database decisions about the efficacy of supervisionary practices were used. Okay, And then lastly, we're just going to look here at our references. Thank you.